Sickle cell anemia. Normally, red blood cells are flexible and round, which makes it easy for the body cells to get nutrients, oxygen, and remove waste. But in the case of sickle cell anemia, red blood cells are sickle-shaped, rigid, and sticky, making it harder to perform these functions. Often, these sickle cells are useless and can cause pain throughout the body.
Sickle cell anemia is caused by the genetic inheritance of both recessive sickle cell genes. What does the patient look like, feel like, and what problems do they have? What's their diagnosis? A symptom of sickle cell anemia is fatigue. Fatigue develops when not enough red blood cells are being delivered to the body. Therefore, body cells don't get the oxygen it needs to feel energized and perform proper functions. Other symptoms include pain, fever, pale skin, and swelling in the hands and feet. This is caused when sickle-shaped red blood cells flow through tiny blood vessels, and sickle cells block the blood flow to the extremities. Chronic deprivation of oxygen-rich blood can damage nerves and organs. Sickle cell anemia can also lead to stroke, gallstones, leg ulcers, pulmonary hypertension, and blindness.
What organs are affected? What organ systems are affected?
Liver, heart, kidneys, eyes, bones, gallbladder. Sickle cell anemia can affect any of the organ systems, but the respiratory system is the most affected. This is because the defected hemoglobin and the sickle shape of the red blood cells decreases the maximum oxygen capacity of these cells. Also, blockage of the red blood cells in the veins, arteries, and capillaries causes the flow of blood to the lungs to be decreased. This means that there is less oxygen being carried to the lungs. Because of all this, there is overall less oxygen being used throughout the whole body.
Pain medications can be taken to ease the severity of symptoms. Drinking about 8 to 10 glasses of water daily can prevent and treat pain. Blood transfusions may help treat anemia and prevent stroke. They are also used to dilute sickled hemoglobin with normal hemoglobin to treat chronic pain. Vaccinations and antibiotics are used to prevent infections. Folic acid will help prevent severe anemia.
Hydroxyurea helps reduce the frequency of pain and acute chest syndrome. It can also help decrease the need for blood transfusions.
Regular eye exams are done to screen for retinopathy. Bone marrow transplants can cure some people with sickle cell anemia, but are only done based on the severity of the disease.
In Canada, there are approximately 3,000 to 5,000 people with sickle cell anemia. Sickle cell anemia is the most common inherited blood disorder in the world, Africa being the most common due to lack of resources and treatment options. Sickle cell anemia is a genetic disorder that cannot be prevented. However, it can be diagnosed with prenatal screenings and newborn screenings.
Created using Powtoon.